Hello, welcome to the Centre for Computing and Social Responsibility Surveillance Group discussion. Today, we're going to be talking about what are the issues of truth and trust in digital surveillance technologies being developed to fight the current pandemic. So to open the discussion, I would like to introduce Dr. Neil McBride, who will start talking hopefully immediately.
Well, thank you. I think that advent of coronavirus has moved surveillance and total surveillance on 20 years in a couple of months. We now have an expectation that through contact tracing, everything we do will be known about, and we accept that. The question is then, how do we know what is truthful about what is being put across? And I think that we will also, privacy is out the window, basically, as we all say, the risk is such that we will accept a level of surveillance that we would otherwise not accept.
Yes, I think that one of the things about truth and trust, one of the problems we have is that when we look talking about the media, we are no longer, well, we're no longer really sure that what the media is telling us is entirely true, partially because there is now a lot of what we could conceive to be vested interest in pushing certain agendas or nudging people into certain behaviours that perhaps suit an agenda that the individual being pushed is unaware of. I think that also is quite noticeable when it comes to things like the social media, how that pushes certain political and social agendas. So I think when you mentioned trust there, I think that's a really important point, the fact that we don't actually know what we're being told is true or not true or partially true, and sort of maybe even sort of spun in a certain direction. As you know, statistics can be interpreted any way that somebody wants to. So yeah, truth and trust is definitely an issue. Damien.
Yeah, I wanted to discuss this issue in relation to trust, especially in BEM communities, Black, Asian, or ethnic minorities in the UK. There's no denying the fact that the digital contact tracing technology would definitely potentially have positive impact regarding stemming the spread of the virus, but it's as much a political decision based on economic reasons as it is a public health intervention. Much of the concerns in some quarters are not related to the architecture of the technology, but on the socio-political context into which they are being deployed. That is why the existing socio-political dynamics of the BEM communities in the UK raise serious concerns about trust. According to the latest statistics on COVID-19 deaths from the Office of National Statistics, members of the BEM community are about 4 times more likely to die from the virus than white. That means effective testing and contact tracing are critical for this community. But the question is there sufficient trust in the government within this community to motivate them to use it? In many ways, trust and confidence in the government among UK BEM communities have worsened in recent years. And there are justifiable concerns within this community that the government will use this to expand arbitrary and unfair surveillance and also violate human rights beyond the pandemic. The rights to privacy, the rights to work, and the rights to movement. The historical legacy of the disproportionate surveillance of BEM members has definitely created a deep cultural unease with any type of mass tracking at all. It might be perceived that the higher numbers of people from this community will be traced and quarantined. This idea alone can breed mistrust in the system. And there's no indication that this technology...
Yeah, and if there's no trust, then the system won't be taken up. These track and trace people will fail to actually download it. And if that is disproportionately within the BAME community, then the fact that they appear to be more badly affected by the virus means that they will be even less protected because they're not going to take it up and they're not going to be able to involve themselves in track and trace. So it's a bit of like a circular issue there, you know, one impact feeds off the other. Yeah, Anthony, you have something to say there. Would you like to add your point? He says, truth will go out of the window if the application is no good and doesn't work, and death rates go.
This is work in progress. So, you know, we might have good results initially, and the technology might work initially, but as the disease progresses, as maybe there's a cluster or more people get infected, like we have a cluster with care homes, we'll end up in the blame game, and people will start, you know, if the application is pushed as the panacea to solve the crisis, and the expectation isn't met, people won't use it, or won't sacrifice the bargain of their privacy to use it if it's not seen as being effective.
Yeah, okay, thank you. Gosha, you would like to have a question, please?
Yes, I would like to back here to the beginning. I really appreciate input here from Damian and Anthony. You talking about how the application is designed, but do we really know, yes, what the problem we try to solve? Simon Rogerson, so founder and former director of our center, was saying doing right things for the right reasons. Do we know the reasons? Do we understand our society? Do we really go to address society needs? The one more person I would like to quote here is Brand Nolson, who is talking that when we're trying to develop any technology for the society, we need to embed the values. Do we know these values? If not, what we're trying to achieve?
Okay, so anybody like to come in and respond to that? Martin, please feel free. Martin, you've got to take your microphone off first. Yeah, Martin's ready. Then Neil after Martin.
Okay.
Go ahead, Martin.
Two problems. One is that embedding the values is a technologically hard problem. The other is that my reaction to Damian's comments on what discriminated against minorities view is that the message from this is pale faces, don't be so bloody complacent. We're right and you're wrong about this.
Interesting point. Neil?
I think that there's another dynamic that you know, the ethics, embedding the values in the actual technology is almost an irrelevancy, because what is the issue? The issue is what is the risk? How are the politicians and the scientists putting across the risk? If the risk is enough, then the technology will be accepted and used regardless of what the ethical issues might be with it. So if you can convince people that the risk is high enough with coronavirus and that it's going to be countered by having a tracing app that gives all your information, then you can get the population to go along with that.
Simi, would you like to come in and give the legal perspective on that then, please?
Yeah, thank you very much. Just looking at what the legal issues are around here and whether or not we have been misleaded. Just to take you back to the e-health network, that's a voluntary network that was set up under Article 14 of the 2011 European Union Directive that talks about cross-border interventions in patient healthcare. So this network actually provides some guidelines as to how mobile applications should work. And one of the issues, there are actually 4 issues that have been identified that mobile applications should take cognizance of. And one of it is that the essential requirements of any mobile application should be voluntary, so that participation is voluntary. It should be approved by a national health authority. It should be privacy preserving, and it should be dismantled as soon as no longer required. So whilst these 4 issues have been identified as critical to the intervention in terms of COVID-19 and the digital intervention we have, we do not know to what extent these four ideas will be preserved. Will it in effect be voluntary? Well, there has been an approval by national authority, but is it privacy preserving? And that also goes back to what Damien has said regarding, marginalized communities in the BIM industry. And then it talks lastly about being dismantled as soon as no longer needed. Well, to what extent will the data that is already on that system be used continuously even after the COVID-19? So these are the privacy issues that the legal, response to this pandemic has brought to light, and we do not know whether this would be, adhered to, or would this even raise further concerns.
Thank you, and I think you're quite right. This actually leads on to quite nicely to what you would like to say. If you'd like to say, jump in now about social issues that you said. Sorry. There's obviously the social issues that are the major impact on people. You've got all the different aspects. You've got the legal aspects like you just mentioned there. We also have the technical problems that are arising from the use of the app. From what I understand, it's not exactly working so well. Anyway, yeah. If you'd like to continue talking about social pressure.
Yes, I think that also connects well with what Simi just said. From my point of view, the use of the app also raises various questions regarding social and political pressure. I mean, in democratic societies, the voluntary use of these applications or location tracking devices based on appropriate consent and temporary use of data and so on, seems obviously the most appropriate way forward. Mandatory forms of application, as in China, and as now more recently in India, democratic society, just reek too much of authoritarian government. However, and that's the key point, the line between mandatory uses of the application and uses that are triggered by forms of social or political pressure in a voluntary framework can be thin. Many people are simply likely to feel compelled to use the app, even though they do not want to use it or have concerns. And forms of social pressure can emerge, for instance, through neighbors, employers, pressure from colleagues, or also aggressive advertising on social media or other media. And I think that is a critical point that one should also keep in mind.
Very important. I think the whole idea of social shaming is already starting. I've seen it quite a bit in the media. You've got people who are basically making their judgment from their bedroom. So they're looking out the window and they're seeing a neighbour turn up, and they may be delivering medical supplies or something, but they accuse them of breaking lockdowns and things like that. That's, and you can see how the same mentality will say, if you don't download the app, you must want us all to die from the pandemic. They will take it all the way to the next level. Okay, Damien.
Yeah, exactly what Akin was saying there is something I wanted to happen. And for us to convince people to buy into this, we have to put measures in place to address or mitigate these social impacts. These are social legal impacts. Recently, the Ade Lovelace Institute conducted a rapid review of this technology and found out that the social impacts actually outweigh the scientific evidence to actually implement this technology. So we have to, first of all, establish methods or approaches of mitigating social and legal impacts of this on the people before people can definitely buy in.
Yeah, okay, thank you. Gosha, you had something to add?
Yes, so my experience and what we're saying here brings me to one of the conclusions, thinking this will be different for different societies. Some societies will accept it easier because of the history, because of the experience. For some will be more difficult, and yet now if they feel that the government is not really trustworthy, how we should act with this? Shall we take into consideration, maybe ask them more questions to make them feel that is something that what is going to really help? Or how are we going to deal with the feelings against, or how are we going to make them believe that this is not necessarily good for them? You can see two possible ways here.
I think we will have the if you're doing nothing wrong, why should you worry about the level of surveillance argument will continue to be thrown out in front of us. I haven't yet seen the arguments that Bush gave. I think it was Bush after the 9/11 attacks. The whole idea, if you are in any way questioning us, if you're either with us or against us, you're either part of our little gang or you're actually an enemy, which is a very different thing from having different perspectives on things. It is saying that if you don't have the group think a particular directions is pointed, why am I waving my arms around? Particular direction that is pointed out by whoever is in charge of the messaging, then you are seen as being almost subversive. And then we could get into some very, very dangerous conversations about democracy and what it means to actually have the right to make your own decisions and to actually have an influence on how you're governed and so on and so forth. So yeah, very, very difficult. Anybody else would like to come in?
But if your subversion, your democratic right to say, I'm not taking on board this app, or I'm going to run around and I don't care, if that is seen as a risk to health, in other words, if through the public perception you can pitch the risk, the danger, the existential threat as being much greater, then you override democracy and you expect that everybody will knuckle down and do as is expected.
Yeah, I think the teachers, some of the rhetoric in the papers, some of the things being said about teachers has been quite astonishing. The demonization of this particularly, hard-struck professional group in just having words of concern expressed about the timetable and examples of, I think Denmark was one that was thrown at the teaching profession as well. The Denmark have opened their schools. They've had something like, a few hundred deaths in total, and have been doing a very, very different sort of strategy and all the rest of it. So we can't really compare ourselves with them, but it seems it's politic to do so in order to add further pressure onto our people. So I find that quite disturbing. It's all part of this whole social shaming to get you to comply with whatever it is that the government is expecting. Okay, right, okay, Tony. Oh, and I think Anthony should have been first, actually. Anthony, please.
Oh, I just wanted to mention that people were almost putting one profession up against another one. The nurses have sacrificed a lot to look after people, so therefore now it's the teachers' turn, is some of the flavour that's getting on in the news. So in other words, it's acceptable for our health service to have a certain amount of risk, although there's been a lot of debate about preparation and PPE. I think the teachers' blowback, as it were, is PPE doesn't work in an educational setting. So
interesting.
There's a polarization. People are trying to polarize the debate, which isn't appropriate, I think, in that situation.
Absolutely. Yeah. Tony.
Hi, yeah, just linking a couple of points here. So Neil's discussion about social pressure for people to have the app, but then also looking at Damien's point about actually there being a low uptake for BAME populations, which are also very hard hit by this virus at the moment for whatever reasons we could discuss there. There is also another group that's particularly vulnerable, that's also unlikely to have access to the technology to have the app, and that's the elderly. So the question is here, is there going to be a dislocation in that social pressure for a group that is A, most hard hit by this virus, but also B, least likely to have access to this technology that the government's saying will protect them? And I guess that raises debates there about who can and will benefit.
Yeah, Gosha?
So the question would be here, what about the education? We're talking about democracy, we're talking about social shame. Would these questions, or could be these questions answered if we had proper education there and people would be more aware? And who should be responsible for this education, and who should be involved in this education, so people can make better decisions, better informed decisions?
Of course, that wouldn't have helped with Tony's point, because a lot, no matter with the education, a lot of older people don't particularly want to engage, and they find it difficult to engage. They don't have the equipment, they don't have the money to buy the equipment. They've got to start from a low base of knowledge before they can get to that level of competence with the technology. And they are people that are being directly targeted. So yes, interesting. Damien.
Yeah, there are also issues of potential false positives and false negatives that can raise questions on how much can we trust this technology, because the technology carries the risk of false positive, wherein a user may be falsely alerted despite not having been in contact with the virus, because depending on the power of the Bluetooth in your phone, Bluetooth radio waves can actually pass through walls and glass. So you can get an alert and you have not been in contact with the person who has COVID, and that might raise the temperatures of the society. So how much can we trust the society if there are potential cases of false positives and false negatives?
Okay, thank you. Okay, carry on. Hand, Maxime?
Ah, yeah, okay, sorry, yes. No, I think a more general question is also, will COVID-related surveillance actually result in a more broader increase of surveillance in other forms of governance? You know, because the data will be available, new infrastructures will be introduced and legitimized, maybe also facial recognition software, or also the location tracking. So will this result in a reconfiguration of how governance and population governance and individual governance takes place, and will surveillance increase at a more broader level? So I think that is a crucial question.
Thank you.
I think you're right.
Carry on.
So
yeah, carry on with the response. Then Anthony can speak, and then Tony.
okay. I think you're right there. What this does is sets a precedence and sets all the technological infrastructure and the means and the political possibilities in place for some later application. And you only need an application which in some way is acceptable to the population, which you, through coercion or through media and marketing persuasion, that we need to have everybody registered with certain information or whatever. So I think there is that risk that some future ideology could apply the approaches.
Thank you. Anthony?
Well, going on from, I think it was the guy with the glasses, I've forgotten his name. Damien, was it? No. About how this project could creep into other areas. And I think Tony's sort of view that certain part of the sector will be disadvantaged by this application because they don't have access to the smartphone technology. We do have contract tracing in place at the moment in other areas like tuberculosis and sexual transmission diseases. Just to ramp up the heat a little bit, you can imagine that all online dating applications might be extended to surveillance to reduce the impact of sexually transmitted diseases. And I'm sure the take-up of online dating wouldn't be very popular. So maybe one of the ways that you can colour or advance the argument is to see how this technology might be imposed in other areas that affect our daily lives.
Yeah, potentially it could infect, if you like, every aspect. Tony?
just linking here with Achim's and Neil's points that actually this data is being collected, and I know Neil was talking about could it be used for something else in the future, but also actually could this kind of data be used for something else now, an additional level of surveillance, for example, people's location data being used to include or exclude them from police investigations. You know, just because surveillance might be extended doesn't necessarily mean it might only be extended in the future.
Yeah,
True. Damien.
Yeah, my question then will be, what can we suggest to policymakers in relation to this? I will think for me, coming from the BEM community, I think there needs to be approaches established to address social risk in order to address and to protect against exacerbating inequalities and vulnerabilities, especially in the BEM community. There needs to be an inclusive engagement with the BEM community to address these issues, both of practical use and of trust.
Yeah. Aki?
Just to follow up quickly from Tony's comment, I think it is really a crucial question whether the use or the misuse of the collected data can effectively be governed and whether misuse can be prevented, for instance, for secondary purposes like surveillance or anti-terrorist or policing. But there's also the risk of unwanted use or leakage of data to corporations, for instance, and secondary private sector users of these data. So the more general question, I think, is it really realistic to assume that data will be deleted and that they can be reliably governed and that trust can be maintained? Or is it simply unrealistic and there will be a diversification in secondary users which are unavoidable?
Interesting point. Thank you. Martin Stacey, next question. We have about a minute left and then we'll be summing up and completing our talk. Martin?
That we also need to watch the legal infrastructure, because promises from governments that something that is legally permitted won't be done, such as on the subject of surveillance, doing things that for enforcing traffic laws that was legal infrastructure created for counter-terrorism, those promises aren't worth the hot air they're spoken with. That governments, given legal powers, will use them in ways that they promised they wouldn't.
Yeah, actually, I think that is a really, really good final point to make, actually. Thank you, Martin. I think this has been a very interesting conversation. I do think it's actually probably raised more questions than we started with. But I think there's some really, really important key issues here with regards to access, education, specifically to do with vulnerable groups, BAME, people are directly being, they seem to be badly affected and not taken into consideration. Then we have to consider about the legal and the public policy implications, and that doesn't even get us started in how we personally feel about that level of surveillance. And we have obviously we have the concerns over public pressure, social shaming that will actually pressure people into taking up apps and things, surveillance levels that they would never have agreed to had they not been given this, oh, you want to kill us all if you don't. There's a motive to things that come out in the press. The very aggressive approach of some of the press will add further pressure to people to take up an app that actually is probably not fully thought through properly, and certainly may have implications for the future that we are not fully aware of at this point.